The number of deaths worldwide due to coronavirus is increasing continuously. Millions of patients are infected due to this virus. Alert is going on around the world. In such a situation, we are giving you complete details about the symptoms, treatment and prevention of the disease. The first positive and confirmed case of coronavirus COVID-19 has been reported in UK. Apart from this, a patient of coronavirus has also been found positive in Telangana. The Delhi patient has been kept under separate surveillance at RML Hospital. So far, 88,000 confirmed cases of corona have been reported worldwide and more than 3,000 people have died. The coronavirus, which started from the Chinese city of Wuhan, has now become a serious threat to the world. In view of the increasing fear of corona, vigilance has also been increased in India. Aerial passengers coming from different countries are also being strictly investigated. After all, what is the coronavirus, its symptoms, treatment and prevention? Know everything here. What is the coronavirus spread from snakes to humans? The coronavirus is a large group of viruses that can cause a common respiratory problem in humans ranging from a common cold. In addition, coronavirus can also cause fatal diseases like SARS and MERS. The virus is named after its shape. Research has revealed that this coronavirus has passed from snakes to humans. The virus is related to animals and has entered into the wholesale market of meat, poultry firms, snakes, bats or farm animals. How dangerous is this virus? Health officials around the world are cautious about this virus and are advising people to be vigilant, but the exact information about how dangerous this virus has not been found so far. What are the symptoms of coronavirus infection? The coronavirus causes a mild infection in the respiratory tract, as commonly seen in the common cold. Although the symptoms of this disease are very common and no person is suffering from coronavirus, then such symptoms can be seen in it. Such as a runny nose, severe headache, cough and phlegm, bad fever, feeling tired and nauseous. What is the treatment of coronavirus? Although no vaccine has been prepared so far to fight this disease, the officials of NIH, U.S. National Institute of Health have said that to fight this disease of viral pneumonia spread due to coronavirus, a vaccine is being made for this and soon its human trials, i.e. trials on humans, will begin. Apart from this, it is treated like a common cold disease in which it is advised to take a lot of rest, article submission, to eat more fluids and to get fever and sore throat medicine. How does COVID-19 spreads its symptoms and some of the facts which everyone should know about? To understand this, you will first have to know about some basics of this virus. COVID-19. How does COVID-19 spread? You may have tons of questions about the novel coronavirus, and one of these questions will definitely be about understanding how this virus spreads. To understand this, you will first have to know about some basics of this virus. The novel coronavirus is SARS-CoV-2, which is its clinical name. This is an acute respiratory syndrome coronavirus 2. The origin of this virus traces to a family of other viruses that are responsible to cause respiratory issues and respiratory syndrome. The novel coronavirus is a new strain. This means that the virus is not familiar with the human immune system. This also means that there is still no vaccine for this virus. When a person comes in contact with the coronavirus, then he is diseased with the virus COVID-19. The virus is respiratory. It means that respiratory droplets are the carrier of this virus. Here is how the novel coronavirus gets spread from one person to another. You should also take care to understand the protection methods from this new virus strain. How does coronavirus spread from one to another? Be alert and stay safe from COVID-19, everyone. With citizenship comes great responsibility. Being a citizen of a state is not only about fundamental rights, but it comes with duties too. In the tough times like COVID-19, responsibility as a citizen increases manifold. We all know this is just not another virus. It's highly contagious, because it can stay alive days outside human body, in air or other surfaces. Antidote are still under testing phase. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or eyes. However, this is not thought to be the main way the virus spreads. So, to reduce its spread, we have maintained social distancing, must stay at home, and if traveled recently, should go in self-quarantine and avoid close physical proximity even from family members. In case of any symptoms of corona, consult doctor immediately. And follow the instructions. As a citizen with no travel history or symptoms, we can do our bit too, by following Gov. orders of staying at home and stay safe. And help Gov. control this pandemic in lesser time, avoid unnecessary travel or movement on roads. The current spell of the lockdown, billed as the world's largest shutdown to check the spread of the infection, ends on Tuesday even as the Union Health Ministry asserted that the tally of confirmed cases could have reached 8.2 lakh by April 15 in the absence of the lockdown and other containment measures. Some tips for social distancing. Follow guidance from authorities where you live. If you need to shop for food or medicine at the grocery store or pharmacy, stay at least 6 feet away from others. Use mail order for medications, if possible. Consider a grocery delivery service. Cover your mouth and nose with a cloth face cover when around others, including when you have to go out in public, for example to the grocery store. Stay at least 6 feet between yourself and others, even when you wear a face covering. Avoid large and small gatherings in private places and public spaces, such as a friend's house, parks, restaurants, shops, or any other place. This advice applies to people of any age, including teens and younger adults. Children should not have in-person playdates while school is out. To help maintain social connections while social distancing, learn tips to keep children healthy while school's out. Work from home when possible. If possible, avoid using any kind of public transportation, ride-sharing, or taxis. We are facing tough times. After message of Prime Minister of complete lockdown across country, daily wage earners will not be able to meet their daily needs requirement. Help them in all possible ways, give them food and money. Do not deduct salary of your maids, drivers, cleaner and others. The Department of Pharmaceuticals and the Ministry of Consumer Affairs have been asked to take necessary action against anyone charging exorbitant prices for masks, sanitizers and other health-related logistic materials, it added. The government has also asked the private sector to work from home and has also asked Group B and Group C central government employees to attend offices on alternate week and staggered timings for all employees. Let's stand united and fight Corona, and defeat the pandemic COVID-19. Being a citizen of a country is not only about fundamental rights, but it comes with duties too. And we are trying to do our duties as much as possible with the help of our government. Hashtag stay safe, hashtag stay healthy. The main transmission method of this virus is the person-to-person contact. Imagine that you are sitting close to a person who is already infected with this virus. The infected person sneezes or coughs and you catch the virus. If the infected does not cover his nose and mouth, then they can immediately spread it to you. If the droplets land on you, then you get infected with the virus. You can also contact the virus when someone who already has the virus touches his or her mouth or nose with his hand. When you shake hands with this person, then they transfer the virus to you. Once you touch your nose or your mouth without washing your hand, you give the virus entry into your body and thus you are now infected too. There is also a study to understand if coronavirus spreads through feces. It may contaminate the bathroom and the toilet bowls. Further research, however, is needed to understand this method of transmission. Spreading the virus without any symptoms. WHO states that if one does not show symptoms of coronavirus, then his chances of spreading it to others are very low. But here there is some bad news. Experts are countering the views of WHO and say that there have been cases where one who did not show any symptoms of coronavirus passed it to others. The carrier was not even aware of the fact that he was sick. A person is most contagious when he is showing symptoms of the virus, and this is when they are more likely to transmit the virus. However, there could be some who may transmit the virus even before they show any symptoms. It could take 2 days to 14 days to show up the symptoms of coronavirus after one has been exposed to the virus.